Do you feel stigmatized by a cold sore around your mouth and really embarrassed? Well, I am your local OBGYN. I love women and let's talk about it. So, one of the most common viral infections in the world is a cold sore, which is otherwise known as a herpes infection. Often it's categorized as a type 1 infection, but it can also be the strain type 2. This being said, usually what happens is when we are kids, we might share a sippy cup or kiss a relative or something just really innocuous happens that has no bad intent, and suddenly you see a kid with a blister right at the edge of their mouth and it's painful. There can be prodromal symptoms, and this means that you can feel sort of like a burning or a tingling before it starts, and the first infection is generally the worst. What we'll see is your body kind of like stores the memory of how to make this blister happen. And some people may not see another one come out. Some people may see them with some regularity. Stressors like being unwell or being stressed on its own, like just emotionally stressed, can actually trigger them reoccurring. So, what can you do? You can talk to your primary care doc or your OBGYN about going on something more regularly if you're getting a bunch of these pretty regularly in order to try to reduce the recurrence. There are some topical things, they're not as effective, but the antiviral medications are actually pretty reasonable to go on. This being said, what you can't do is if you have one of these or even symptoms without the sore, do not have oral intimacy with your partner. Number one, and don't kiss any babies because it can make them incredibly ill and dangerously sick.